Hello everyone, my name is Fabian Prasser and I'm head of the Medical Informatics Group at the Berlin Institute of Health. Today I will present work of my group in which we develop data anonymization pipelines to promote open science on COVID-19. There are many ways in which AI applications can help to manage the COVID-19 pandemic. However, AI methods become better the more data is available, which leads to data protection challenges. Innovative concepts are therefore needed to provide data at the rapid pace required in a pandemic. LEOSS is a European registry capturing data on the clinical course of SARS-CoV-2 infected patients that was established at the University of Cologne. The registry uses an innovative approach in which no informed consent is necessary as data is collected in the form of anonymous reports. It further follows an open science approach in which anonymous data is shared with researchers and the public. For this purpose, additional anonymization procedures have been implemented which modify the data to ensure that it cannot be identified. The anonymization pipelines used by LEOSS have been implemented in collaboration with my group in Berlin. The development process is innovative by itself because the pipelines have been developed in Berlin without access to the data stored in the registry in Cologne. Instead, synthetic data was generated and used as a basis for an iterative refinement process. For this purpose, different versions of the pipeline were developed and repeatedly evaluated using the data stored in the registry. The pipeline was implemented using ARX, which is an internationally recognized anonymization tool developed by our group. ARX offers a comprehensive feature set including many different types of techniques that can be used to anonymize data in compliance with different laws and regulations. When anonymizing the LEOSS dataset, we combined qualitative risk assessments with quantitative approaches. Here, we followed recommendations by the Article 29 Data Protection Working Party to protect data from three types of threats, namely singling out, linkability, and inference. To implement this, we used formal anonymization processes that deleted data based on mathematical models. We performed repeated evaluations to monitor the impact of the anonymization process on output data quality. The pipeline developed is based on the principle of hiding in the crowd, which means that the greater the number of patients included in the registry, the less information has to be removed to achieve the required degree of protection. The figures on this slide show the development of the number of records released and the differences in the case fatality rate calculated from the original dataset and the anonymous public use file over time as more and more patients were included. It can be seen that impacts on data quality decreased rapidly and that there is no significant difference between both datasets today. The work presented in this talk was done in close collaboration between my group and Caroline Jakob and Janne Wereschild from Cologne as well as Florian Kohlmeier from Munich. If you're interested in further details on our work in the health data privacy field, please get in touch. Thank you very much for your attention.